Now to growing concerns about the deadly coronavirus.
Cases of coronavirus.
It's a new type of coronavirus.
The novel coronavirus outbreak spreading across the world.
My name is Brian Evans. I am a correctional officer at the medical facility in Vacaville. And the way COVID affected my work is, at first, not at all. It hadn't made its way through. It was going through other prisons like St. Quentin, and then finally it made it to us. And things went really crazy. Trying to isolate inmates in a prison is very hard to do. A lot of inmates getting sick, a lot of units going to isolation. It put us at risk, everyone at risk. Yeah. And just got real dangerous. And then medical took over my prison and they don't really know how to run it. Also affected the staff member. We were getting tested weekly.
Wow, yeah, that's quite.
And a lot of staff members got it or were exposed to it, and we were taken out of work for 2 weeks. They got the vaccination. Okay. A lot of the staff members got it, and the inmates started getting it, and now it's not even, COVID at the prison is not even a problem.
All right, that's awesome.
It's just kind of disappeared, which is nice. So I guess the vaccine's working.
Definitely.
Over the past year with COVID, we've seen a huge influx in how we manage our patients and treat patients, especially with the isolation precautions in the healthcare setting. And also how to deal with something when you're not sure exactly what you're dealing with is a challenge. So for us as healthcare workers, we kind of go overboard on what we should do and listen to the guidelines set by the CDC and by the county and other healthcare facilities similar to our facility that we work in. So I think we take for granted how we see and treat patients sometimes. As the influx of COVID patients come into the hospital, you see a demand on regular patient care. How does that affect how you schedule procedures and how you do things? And is it safe for people to come into a facility and receive care? I think the worst outcomes that we've seen for patients are those that are afraid to come into a facility and get treatment. People who need a gallbladder removed or an appendix or have chest pain and are afraid to come to the facility because they're afraid of catching COVID. I think those were some of the struggles that we had to deal with.
Like if any learning's taking place, it's purely on the initiative of the students. Like if you didn't want to learn anything, you could have made it through this whole year and had no recourse. What I would never subject a human to this.
Definitely.
This is almost like torture. The question should always be for a teacher, how does this help my students? In the same way, like if you work in customer service, your goal is how do I make this experience more intuitive or better for the customer? So essentially my students are my customers and I'm rendering a service.
It kind of just got in me and checked me out, kind of found where I was weakest and kind of attacked there. And after talking to several friends and clients and other people that have had it as well, they kind of agreed. They're like, oh yeah, I was in a car accident, my neck and shoulder are all messed up and that's where it got me, or, things like that. So that was kind of my experience with it. It was kind of weird. And then it lasted a really long time. So I was sick. Really sick, couldn't get out of bed sick for 3 weeks to a month.
Was, I was caring for my ailing father at the time. Before COVID broke out, he had been diagnosed with leukemia, and we were going to Kaiser Walnut Creek, several times, at least 3 times a week, for blood transfusions and platelets and things like that. Really got to see the changes and the impact that was had at the hospitals. It was a place that a lot of people didn't want to be going while COVID was happening. Where he used to get his blood transfusions and his, blood checks and all that. I used to go and sit next to him. It would usually take several hours, and I would sit there with him. And as COVID continued, it became, I wasn't allowed into the lab with him. I'd have to sit outside. And then as things got worse, it was like you couldn't even go in and sit inside. I just had to bring him to the door, and then I had to immediately leave the hospital. A girlfriend that he had for decades, she got her own cancer diagnosis and kind of spiraled mentally out of control, kind of went into a catatonic state. And so, I was also dealing with her health crisis. So again, we went into the ER during all this COVID stuff. It was very kind of surreal. There was a whole separate section of the ER for people who were coming in who thought they might have COVID, kind of like a special tent, and people with hazmat suits. Even family wasn't really allowed to see her. Same thing when she left the hospital and went to a mental health facility. Again, really sad. They didn't have any sort of visitors. We weren't allowed to go in and see her in person. My father eventually, he did pass away. He battled leukemia for a couple of years, but he passed away, while COVID was all still going on. And, again, even that was affected by COVID in terms of, the funeral and, who we could have there at the gravesite. Again, it was outdoors, I think, which helped. Because I think there were even more restrictions on indoor burials and kind of services. But even then we were limited to a certain number of people. Everyone had to wear masks. There were certain things that we could or couldn't do.
Things that stood out the most to me as being major changes and new precautions were, one of which that happened really early on, is my husband wasn't able to attend any of our prenatal visits. That was really, really disappointing. He wasn't able to actually watch any of the sonograms or the ultrasounds and listen to the baby's heartbeat. So I had to go through those appointments by myself, which is really a bummer because it's something you want to share together. And another big change I noticed during the actual labor and delivery part of the pregnancy was that we were not allowed to have very many visitors into the hospital. I was allowed to have my husband, one partner, or whoever you can designate, and that's how the regulation had been throughout the COVID. But recently, just in the last several weeks, my provider, Kaiser, decided to allow one additional visitor. And so we had my father, which was really great, But the whole family would normally have come to the hospital to see the baby, and it would have been a lot more relaxed and family oriented. So that felt really restrictive and isolating. And again, I think I felt safer that way, but it was also a loss. So there were pros and cons there.
The COVID-19 pandemic has become not only a challenge to healthcare and economies, it has also become a test for social solidarity. People caring for one another, even those they don't know. After all, we're all in this together. Healthcare workers are putting their lives on the line every day. Millions of people have lost their jobs. Families have been separated and torn apart. But we will come back stronger. Learn more on how you can help at cdc.gov.